can you guys see this? So chin down. So we can, down a little bit. So we can see all of this. See all this loose skin? You really capture that loose skin. Put your chin down. All this loose skin. Put it all the way up. And then see how it's all this is very loose. So all this is going to get tuned up. And you can see that beautiful face coming out when I just do that. And that's really what that mid-face lift, lifting this tissue that's hanging down over the lips and nose, lifting that mid-face up, that's where all the magic is. The rest are lesser details, but getting this done, and look at her eyes, even without a blepharoplasty, look how her eyes look better, minus the wrinkles I'm making by pulling skin. That mid-facial volume is so important, so clutch to facial aesthetics. So doing a facelift like a lot of people do, where you're pulling up here and leaving this alone, you guys see that? That's just kind of like what most facelifts are out there. That's what most facelifts that I revise. I do about 50% revisions, 50% primary, and most of the ones I revise have this tight vertical skin lift, and the docs are looking, oh, look, we're getting the neck and everything up there like that, but having this without that starts creating
missing all that.
Yeah. It also creates these weird lines that get worse with age. We call joker lines.
Oh.
So see how these lines, the natural lines of this facial skin that sit like this, that looks natural, right? But when you do this vertical weird stuff, you start seeing these weird lines. And in Miami, New York, LA, you see all these women walking around. I'm sure any viewer, you've seen this before. From their corner mouth, this kind of weird saggy thing.
Yes, I know what you're talking about.
Yep, that's the result of a vertical facelift that does not address the deep plane. Now, the last survey I'm aware of by our society says that over 60%, or I think maybe closer to 70% of facelifts done by plastic surgeons today are a version of like a MAERCKS Lift, a minimal access cranial suspension. So it's really the main concept is doing a quick, easy, minimal dissection, non-deep plane vertical lift. And you can see that's a very good example because this patient is a great candidate for a facelift. The skin is thin and very loose, lots of wrinkles, very excessive, without a lot of fat. And she is a patient that's super high risk for these deformities of a facelift that's not done anatomically. In the wah wah. So I'll show that one more time. This would simulate most of the facelift techniques out there. And see already we can see this. This only gets worse with age. Of course, when they're swollen, it will look kind of more like that. But then when the swelling goes away and they age a little bit and this starts going down, this is what we call a joker line. And it's all over the place. Even celebrities, you see them smile and have these weird lines here. That, again, is because of this lateral border, which is what most face and neck lift doctors are really putting the emphasis on. Boom. And look, oh, the neck looks beautiful. But this is a mess. So instead what we do is we do the deep plane support, take the deep neck up with the face, and then once we have that, we tweak it like this. That's what I call Kedge technique, the two vectors, and that's how you get that beautiful, you can already see the former face is beautiful instead of that.